I'd really love to bring Andy into the discussion at this point, given your vast both clinical and research experience. What effect does ADHD have on a patient's quality of life? As that's really the bottom line about everything we're talking about.
Well, absolutely. You know, it's important, of course, that this altered neurobiology causes symptoms, but clinically, the effect is very significantly negative on the patient's quality of life, both children and adults. And it can really have a negative impact on quality of life in virtually all settings, including school, work for adults, home setting, socially, and then psychologically, internally as well. So in school, of course, they can get a lot of negative feedback. They can be in trouble all the time. They're not doing what they're supposed to do. They can be disruptive. There can be detentions, suspensions, and even ultimately expulsion from school. They don't do their homework. They don't do assignments and things they're supposed to do. At work, of course, we know it can be very difficult to meet timelines, to be organized, to work independently. Judgment sometimes is an issue, impulsivity. Socially, at home, of course, we know also this can cause significant impact on the quality of life at home as far as relationships, the stress level it can cause, the negative feedback, the child's always in trouble and being disciplined. The parents are being stressed out by, are we disciplining properly or not? It can cause problems with sibling relationships and the parental relationship, of course. And then socially, there can be problems with peer interactions and peer relationships. I'll never forget a mom one time telling me about her 6-year-old son. You know, he never gets invited to birthday parties. And you could tell it was really affecting him. He was starting to notice that he wasn't getting invited to birthday parties. And so this is a very sad thing. It can also affect the ability of the family to just go out. I'll never forget a mom telling me after successful treatment of her 10-year-old son, she came in virtually in tears, and I thought, oh gosh, something negative's happened here. And she said, we went to the mall this week and nothing happened. And you'd think it was the most significant achievement in the world because they just couldn't take the kid out shopping or to the mall. Now, psychologically, of course, it can have significant impact on the patient's self-esteem, their sense of self-worth, their identity, and they start internalizing very negative self-images. They think of themselves as a failure, as dumb, as lazy, what's wrong with me? So really the impact on quality of life can be quite significant in all spheres of life, and it can affect really all relationships that the patient has.
Well said. And I agree with you. I mean, ultimately, we're not talking about a checklist of symptoms here. We're ultimately talking about functioning, right? How is the person doing in their day-to-day life? And ultimately, to help our patients understanding in this diagnostic and treatment process, what we're really trying to do is assist people to be happier and healthier in their day-to-day living.
I think we should highlight though that this is all evidenced and research based, that quality of life has been measured in children, adolescents, adults, and even older adults over the age of 60. So it's not simply a clinical impression, as your stories clearly reflect, but this is very much research-based and shouldn't be discounted as a clinician's advocacy.
Absolutely, David. And one thing, too, this reminds me of is I've worked with many adults who, when you make the diagnosis, they look back on the negative problems they've had in their life, and there's a grieving process. They can really feel sad. You mean, this was something I've had my whole life that was treatable, and no one recognized it or helped me with this. So I think that's an important aspect.
There's a strong element to psychotherapy, I think, that we'll get to later. But for adults, it's not only the grief of the opportunities lost in the past, but it's the resurrection of self-esteem and self-image and understanding the difference between who they are and what they have, which is ADHD.
Tim, did you have any additional comments you wanted to make as we wrap up this segment?
Yeah, so I think what you just heard from everybody is something that's very important, and that is that this is not a cosmetic disorder. For some reason, some people see this as a cosmetic disorder. And as Andy and Dave said, this is a very serious disorder that really needs to be properly diagnosed and ultimately properly treated.